Welcome to Pediatrics 101. This is going to be found in pages 42 and 43 of your nurse workbook, or you can go ahead and print the page below this video. This video is intended to provide you with additional education beyond the nurse workbook 2.0 and help you beyond the test, but in real world nursing as well. So we just got done learning about normal vital signs on our adult patients, but those are significantly unique and different from our pediatric patients, considering that this ranges from 1 day old all the way up until age 18, or when they're a fully developed adult. Because of this, all of our pediatric patients, as they're growing, are going to need different equipment sizes. So we can't use the same equipment as we do for an 18-year-old on a 4-year-old. We also can't give the same medication dosage for an 18-year-old as we would for a 4-year-old. And all of these pediatric patients are going to have different ranges of vital signs. So when it comes to an emergency and we don't know how much the kid weighs, we don't know how tall the kid is, but we have no way to do this, how are we going to know what equipment we need to provide this kid with, what medication dosages, and where do we even go from there? And that is where our Broslow tape comes in. This is going to be the first intervention you're going to do in a pediatric emergency. So what is our Broslow tape? So this paper tape is going to be a long paper placed from the head of the patient, and it's going to be used to quickly measure our height by what color the patient's heel will land on when the paper is extended. So this sounds really easy, right? Well, it's not when you're in the moment of panic. So at this paper, there's going to be a red arrow on the top, and this is always going to be red to head. And then as the patient is laying on the gurney and the paper is extended beside the patient, where the heel ends on this paper and what color that heel lands on is going to be our section. We don't need to worry about extending the toe. We don't need to worry about if the foot is flexed out or if the foot is straight up in the air or however the foot is. Wherever the heel lands is where you're going to go. Red to head, down to the heel, pick your color. And so these color sections are going to indicate drug dosages, equipment sizes, and resources for this patient's height and weight. And when we know the color, we're going to be able to use this color with our cart, our code cart or pediatric crash cart. And what is in the cart? So for example, if our patient lands on the color blue, their heel ends on the color blue, well, we know that this is typically going to be anywhere from 19 to 23 kilos. We're assuming they're about 5 to 6 years old, and normal heart rate is going to be around 117 and a normal respiratory rate will be 27. So now that we know this information that their heel is on blue, we can go to our pediatric crash cart and we can pop open this blue drawer. So what's inside of this blue drawer in this cart? Well, this is where we're going to find specific drugs, airway equipment, fluids, oxygen delivery tubing, potentially a life pack is going to be on top of the cart, suction, pads, anything for the size of this patient. And this is all really dependent upon what your facility or any facility puts into their cart. It's going to vary by facility. And so you can think of this cart essentially as a code room on wheels. So it doesn't matter where you are, this coat should be fully stocked for the size of your kiddo. And of course, while we're getting into pediatric vital signs, one of the number one rules about taking vital signs on our peds kids is that we need to count respirations for the full minute. Yes, I said full minute. We're not taking it by 15 seconds and timesing it by 4. Absolutely not. We're going to sit there. We're going to inspect, look at the chest, watch the chest fall or belly rise and fall and count for that full minute. And why is this critical to do? Well, the first reason is because their organs haven't fully developed yet. Meaning, in our adult patients, a lot of times when somebody's in distress, their heart could be bad, or maybe they have a bad liver, maybe they have issues with their kidneys, and there's a lot of things that can go wrong. In our pediatric patients, it's safe to say that because these organs haven't even developed, most likely they're not going to be the issue, and usually it's going to be this cardiopulmonary issue. Number two is that Babies will cry or kids get a little startled, and sometimes kids are known to hold their breath, or maybe in the moment because it's stranger danger, they're kind of panicking a little bit inside because somebody's getting closer to them because their heart rate has increased, which is going to require more oxygen demand. So it's great to sit there and look, is this pattern typical? Are they breathing fast for the full minute, or did they just have about 10 seconds of stranger danger and just kind of now are calming down? Or did they cough a lot, clear a little bit of their airway, and now we can get that full minute count? And so below, you can go ahead and fill out the colors that are already done for you. And so you can get familiar with what your pediatric code cart sections should look like. That's it for our small little Pediatrics 101. I'll see you on the next lesson, and we're going to talk more about peds.